When I look back at last 2 decades of dengue management in this country, I have a few regrets. We still view dengue as a pediatric illness. I still distinctly remember a case of bone marrow transplant which we lost to dengue shock syndrome. So we are not looking at that area yet. We need to look at clinical presentations and clinical syndromes associated with the elderly and immunocompromised. The second point is that we are still not monitoring dengue shock syndrome and dengue hemorrhagic fever with a view to detect it much earlier than what it is today. The only parameter that we are following is count of platelets or thrombocytopenia as a marker to detect dengue hemorrhagic fever. I think we need to look for many other biomarkers. Similarly, we don't use ultrasound to monitor and in fact pre-warn ourselves about an impending dengue shock syndrome. That means we need to detect with ultrasound minor amount of ascites fluid by ultrasound of the abdomen, ultrasound of the lungs leading us to early pleural effusions, ultrasound of the inferior vena cava to tell us whether there is a plasma leakage anywhere in the body. We are not doing it. Similarly, our management of dengue shock syndrome is fluid replacement and colloid replacement and so on and so forth. But we are not saying what is the endpoint of this treatment. We are sometimes facing fluid overfill leading to cardiac and pulmonary complications. Even that endpoint of the therapy can be monitored using ultrasound of inferior vena cava. We are not doing it. We need to do a lot more research into biomarkers that will tell us about severe dengue, dengue shock syndrome and dengue hemorrhagic fever. Another regret that I have is certain governments like Tamil Nadu government have used preparations such as papaya leaf extracts to control dengue epidemics. We have not seen this translating into a pharmacological intervention for dengue for the private patient. No clinical trial or significant clinical trial has been initiated on any herbal preparation or any preparation such as papaya leaves in this country, though they are invented in this country. We have claims in this country of many herbal preparations other than papaya leaves to control dengue fever. But no significant pharmacological research is going on to find a components which are actually form the active principle for this action, nor any research in order to make the herbal extracts as such with a HPLC fingerprint. We have not done that in this country yet.